Hi, I'm Christina Metzler, a registered dietitian and certified diabetes care and education specialist at Sentara Northern Virginia Medical Center. Today I'm going to give you some information on a type of diabetes that affects 1 in 10 pregnant women, called gestational diabetes. Gestational diabetes is a type of diabetes you can only get during pregnancy. It develops as a result of the hormone changes a woman's body goes through during pregnancy. For some women, the hormone changes cause insulin resistance, similar to type 2 diabetes, making it difficult for the woman's body to process carbohydrates properly. This results in excess sugar in the blood, some of which is transferred to the growing baby. For the baby, this means more calories and can result in macrosomia, or a baby larger than 9 pounds. This can make it more difficult for a woman to have a vaginal delivery, meaning there is a higher chance of having a C-section. Additionally, there is a risk of infant hypoglycemia at birth if mom's blood sugar has not been controlled. This means the baby's blood sugar can drop too low once he or she enters the world. Other complications for the baby are respiratory distress syndrome and jaundice. For mom, there's a higher risk of developing high blood pressure, having extra amniotic fluid, a C-section, and post-surgical infection. The good news is, if a woman can control her blood sugar from diagnosis to delivery, then she will minimize or avoid any of these complications. Gestational diabetes is typically diagnosed between the 24th and 28th week of pregnancy by an oral glucose tolerance test. If a woman is determined to be at high risk, then she may be tested earlier. Lifestyle interventions are their first line of treatment. Most women are able to control their blood sugar by following a meal plan lowering carbohydrates and exercising regularly. If these interventions do not work, there are several medications approved for use in pregnancy that may be prescribed. Signs and symptoms of gestational diabetes are very similar to symptoms experienced normally in pregnancy. These include frequent urge to urinate, extreme thirst, hunger, and feeling tired. Most women do not suspect they have gestational diabetes before they are diagnosed. If you are concerned about your risk of developing it, you can talk to your doctor about getting screened earlier in pregnancy. Some risk factors are being overweight prior to pregnancy, having a first-degree relative with diabetes, a history of gestational diabetes with a previous pregnancy, or having prediabetes or polycystic ovarian syndrome prior to pregnancy. It is extremely important that women diagnosed with gestational diabetes seek care and follow the instructions of their providers. Most women go on to have perfectly normal pregnancies and deliveries if they follow their doctor's recommendations. Here at Sentara, we offer weekly gestational diabetes classes in which we provide comprehensive education on how to manage the condition. Women often leave the class feeling much better about the diagnosis and confident in their ability to manage it. To sign up for a class, all we need is a referral from the physician. We encourage everyone to get educated on the condition as soon as they are diagnosed to avoid complications for the woman and her child.